Okay, everyone, we'll get started in a minute or two.
Peace and blessings, everyone.
Okay. Okay, thank you everyone for joining us today at our weekly task force meeting. The borough president will join us shortly. She's running a little bit late, but thank you for coming today. We are focused today on the issue of the drug crisis that is happening. I think last week, Gail spoke a little bit about the press conference that she had talking about handling street homelessness and some of the accompanying drug issues with street homelessness. She called for better coordination among city agencies and also talked about the use of the Attorney General's, the Sackler money from the opioid settlement money that is going to be able to be used in the city, somewhere between $140 and $250 million. That money probably is not going to be available to the city until January or February, but it's still good to think about good ways to spend it. So we have a good group of speakers today to sort of run us through some of the new thinking around the drug crisis, where we are coming out of the pandemic, and things like that. So I think we will jump right in, and then hopefully the borough president will join us soon. Our first speaker today is from the Department of Health and Mental Hygiene to talk to us about some of the current thinking in the department. Dr. Cunningham is the Executive Deputy Commissioner for Mental Hygiene at DOHMH. So thank you so much for joining us, Dr. Cunningham. And if you want to just jump right in, and we'll take some questions. Thank you.
Great, thank you. Thank you for allowing me to be here today and talk to you all. So as you heard, I'm the Executive Deputy Commissioner of Mental Hygiene at the Health Department. And before coming here, had spent over 20 years as a physician in internal medicine and addiction medicine in the Bronx, providing care and developing programs and doing research for people who have substance use disorders. So 2020 will be the deadliest year in terms of the overdose epidemic in New York City. In 2020, in the first 9 months, there were nearly 1,500 overdose deaths, and that is basically the same amount as all of 2019. So we don't have our final data yet for 2020, but it really is on track to be the deadliest year ever. Fentanyl is driving the increase in overdoses, with over 75% of overdose deaths from fentanyl. We also know that there's deep inequities in terms of where and who is overdosing, such that neighborhoods like the South Bronx, East Harlem, and Central Harlem continue to experience among the highest rates of overdose in 2020. So what we've been doing in the health department thus far is we're working very closely with our syringe services programs, with our opioid overdose prevention programs, really to help them with telehealth and their virtual platforms during the COVID pandemic, to really think about how to still deliver services in a new way to make sure people have services that are life-saving. We've also partnered with the state to launch a methadone delivery system so that we can make life-saving medication available to people who were not able to travel to the programs. And we also made naloxone available free via mail and at some select pharmacies in neighborhoods that had the highest burden of overdose deaths. In early 2021, the city announced that it's also ramping up additional services totaling $45 million a year. And some of the activities that have been launched, including a new fentanyl awareness campaign, increasing distribution of fentanyl test strips, expanding harm reduction services, so they're drop-in hours and outreach, and making sure that people have access, same-day access to buprenorphine, which is life-saving medication for opioid use disorder treatment. So as we're doing all this, we really need to realize that we have to, continue to do more as the overdose epidemic continues to worsen, and we really need all of the tools in our toolbox. And so, the one now public health strategy that New York City supports is the authorization and operation of overdose prevention centers. So overdose prevention centers are clinical hygienic spaces where people can use drugs under the supervision of trained professionals. These programs exist across the world in more than 10 countries, and they've been in existence for over 30 years. There's very clear data to show that these programs not only save lives, but they also increase linkage to treatment for drug use, to primary care, to social services, and to basic needs. In addition to improving individual health, they also improve community health. So there's less public drug use and less drug-related crimes and less syringe litter around overdose prevention centers. And so, and just in terms of, just to finish, last week I testified at the state Senate hearing, urging the state legislature to approve a bill that would authorize overdose prevention centers. And we are, working at the state level and at the federal level to really, get authorization and open up an overdose prevention center as one tool to all of the other activities that we've been doing to address the worsening overdose epidemic.
Terrific. Thank you. Thank you so much. I know I have some questions. Does anyone have questions on the call?
No, just go ahead and I'll jump in. Go ahead.
Oh, I'm sorry. Go ahead. No, I'm sorry. I didn't know you were here, Gail. Go ahead.
I mean, first of all, thank you very much. I've been around for a long time. So I did go through all of this with Dr. Bassett because we started to do something similar. It didn't really take off. So I guess I'm supportive. They're the most friggin' controversial things in the world. They're sort of right up there with homeless housing. Take your pick, right? But the issue is when you do that, and I know exactly where they're going to go. I'm not going to say, but I know. The question is, what are we going to do as a community? But whether it's on 125th and Lenox, Park, Midtown, I could go through some other places, to work to see if we can get support from those who are using to use the injection. What is it called? I call it overdose prevention center, whatever it's called. Because what happens is I just don't know if those two pieces are going to go together. And if we can, if it does, it'll work. But, there's a great program right now in Washington Heights. We got them some support. It's similar. And there's a program not too far from Lexington and Park, but it doesn't seem to be getting people off the street. So what's your strategy for that coupling of, what the hell's this thing called? Overdose Prevention Center and getting people who need the help to it, because otherwise you're not going to get any buy-in from the public. That's what I'm worried about.
Yep, thank you very much for that question. I mean, absolutely, our goal is to do exactly that, bring the services to the people who need it the most. And so, making sure that, working with our harm reduction organizations that serve people who use drugs, continuing to do and expanding outreach in the communities around the syringe services programs to make sure that people are aware of that, working with our sister agencies, so, Department of Housing Services and their outreach teams. We, in the health department, we have our, also we do outreach with some of our teams like the HEAT team. So really having a multi-pronged approach by working with the organizations that we, are contracted with and support, and then also working with our sister agencies to make sure that people are aware of all the services that exist, and then helping bring them to those services.
People are funny about services, because there's other aspects of life on the street that draw them. What works in Vancouver, where there are 100 such centers? What works there?
Yeah, I mean, opening up the center and working with the communities to make sure that they're aware of it, making these overdose prevention centers places where people want to go, right? Where people are treated with dignity and respect is super important. And we know that they work, that they're effective.
Right. I need more specific because I'm very specific oriented, but go ahead with others. I'm going to try to go to Vancouver because that's what I'm going to try to do. Go ahead, Jessica.
We have a few hands up. Monique.
Yes, thank you very much. And thank you, Madam Borough President, for asking that question. That was a part of the question I wanted to ask. The second part to the commissioner, with these overdose youth centers, I know that's not the exact term, forgive me, but with these centers, how are you identifying the areas where they will be placed, and of course getting buy-in or working with the community to make them aware that these centers exist, or you want to place them? Because I agree with you, we want to treat people with dignity so that they get well, but you also want to be respectful of the community to make sure the community is aware so that maybe the community can help with the buy-in. And many times the community is not informed. Thank you.
Yes, so we are still exploring specifically where the sites will be, but clearly we want to make sure that the places where they are the places that need it the most. And so this is really like everything we do in the health department, it's driven by data. So where are the communities that have the highest overdose death rates, where they really could benefit the most from those services. And we agree in terms of absolutely working with the community. I mean, we've been speaking to local, elected officials. I personally have been, going to community boards, doing talks like this. Have meetings scheduled, to, again, speak to the community, answer questions, address whatever issues are. And so we want to make sure that people really understand what the overdose prevention centers are, the data that support them, and address any sort of misinformation as well. So, we are reaching out very much so at sort of all levels, federal, state, local officials, community boards, and really trying to make sure that people are aware of the information and answer questions.
All right, Val, go ahead, Val Jones.
Yeah, I'm gonna put it the way I think about this. If I'm shooting up in Tompkins Square Park, and I'm pretty happy shooting up there, I shoot up, the cop spot is nearby, I shoot up, I hang in the park, there's a bunch of other people that hang in the park with me. Why should I go to an overdose prevention center? And my other question is, I like shooting up in the park. Yeah, I'm used to that park. That park is like my home. I shoot up, I have friends there. We all shoot up together. The cop spot is nearby. My other question is, you talked about methadone delivery, and I clearly understand why if I don't have an address, I think one of the issues with methadone is how would you, I like the idea of methadone delivery, and I actually like the idea, if you could deliver it to me in Tompkins Square Park, I might be willing to take the methadone if you could deliver it to me in the park, because my life is pretty easy in the park shooting up. And so I want to know why, I want to know about methadone delivery to Tompkins Square Park, and I want to know why should I leave the park to go to an overdose prevention center?
Great, so let me start with the last issue about methadone delivery. So methadone treatment is very highly regulated at the federal and state level, government levels. And so it was only during the public health emergency during COVID in which the regulations were changed. That's what allowed us to do methadone delivery. So we are advocating to continue this. And right now, the state has actually expanded, continued to allow for methadone delivery. And we are advocating for that, to really, push and question some of the regulations that do exist, but it is not, it's really at the state and federal government level, but we are advocating to really make it as accessible as possible. So that's that issue. The issue about the question about why would somebody want to go to an overdose prevention center? So, I would say for many reasons. So one is to be able to have, it's for safety purposes, right? So there's clean needles, there's alcohol swabs, there's sterile water, there's somebody supervising you so that if there's an overdose, because we know that there's fentanyl in the drug supply, that somebody's there to reverse the overdose with naloxone and who have oxygen and who can call 911 if needed. It's also that it's also embedded with a lot of other services, so that if you need to take a shower, if you want to go to the bathroom, if you want to just rest, if you want to link up to social services, a case manager, mental health treatment, drug treatment, right? These will be situated in organizations that have a host of services, so that if you would like to access these other services, that's also possible. So, I think there are many reasons why it would be attractive. It's never happened in this country. So it's a shift, right? And thinking in our brains of like, oh, you can go to this site and use drugs there and you don't have to hide it and you can do it in a way that's safe. That is really, so that you don't put yourself at risk. That's really the main point.
Okay. Barbara Nelson, and then Eva Chan, and then John Gallagher. Barbara, go ahead.
Hi, good afternoon. I'm Barbara Nelson from Community Board 10. I'm also been working in the field of substance abuse. I'm a social worker and a master case act. So I think that most of the pushback or the questions are that many people don't understand that heroin addicts do not use because they want to. They use as a need to avoid the withdrawal symptoms. And in terms of the centers that we're talking about, these prevention centers are saving lives, right? And at everyone's point of life, there's a neighbor, a nephew, a family member, someone that is addicted to illicit opiates. And the goal is to get them off of the illicit opiates and into the programs. So when we talk about collaboration and access and working with treatment programs and community outreach, there's no specific location that the heroin user wants to use. They use as need once they cop the drugs, and perhaps we could even think about putting a mobile station somewhere where they can pass the word on, right? Because they're not always anxious to go inside a site that says, that's going to provide these services. They're very much pretty happy with what they're doing. It's the communities that are upset with how they're going about it and what we have to deal with as neighbors and property incidents that is really bringing this to a total rise. So primarily, I'm saying that we might even think about connecting with some of the non-for-profits that use mobile vehicles, that it can go around in various areas that provides additional access to these individuals that are using because they do not want to be sick. Thank you.
Thank you very much, Barbara. Eva Chan, and then John Gallagher. Eva?
Yes, my thought is that I understand that safe injection site can save life. I think the challenge in New York City is that drug treatment centers are not equitably distributed throughout New York City. So some district, their overdose rate is kind of artificially high because for decades, drug treatment center has been placed in Black and brown neighborhood, drawing in people who are not even from those neighborhoods to get treatment. So I appreciate your attempt to allocate safe injection site based on overdose rate. However, these overdose rates are artificially inflated. And before we talk about placing safe injection site, we must discuss how to better distribute drug treatment clinic first. Otherwise, we just perpetuate this kind of over concentration of drug user in a few neighborhoods of color.
Eva, thank you very
Thank you.
much. Go ahead. Do you want to comment?
Yeah, I do. Thank you. So I just want to comment about two things. So one is the overdose death rates in terms of how we get our data. So the data are not based on where the overdoses happen. The data are based on the zip code of where the person lives who overdoses. So that when you look at the, the neighborhoods that are most affected, those are the neighborhoods where people live, not where they overdose. And so, so I just want to make that point clear. I think the other thing really about when we talk about drug treatment is, there are the methadone clinics, which we mentioned. There's also buprenorphine treatment. There's also naltrexone treatment. There's 3 medications that are FDA approved for the treatment of opioid use disorder. And then there's other sort of non-medication treatment. And so, not all of those. So there's differences in sort of where they're located and really sort of dispersed at the various levels with the different kinds of treatment. So I just want us to be sort of cognizant that there's not one treatment. And I think really, the question and the approach is to trying to figure out what fits best for which person, and that people should have options, right? So they can find the best treatment that works for them. And that we know is based in evidence.
One question
I want
about,
to respond to
Eva, go ahead, because I want to understand about the homeless housing. If I'm living in a shelter, how does that impact? I know Eva was going to ask this question. How does that impact my location of where I live? Because it's really temporary. How does that impact?
Yeah, so that, that level of detail, I can certainly get back to you. I'm not entirely sure,
Okay.
but we can certainly get back to you with that.
Those are the issues that matter to people, those tiny little nuanced details.
I just want to comment too. I don't know if this is specific to East Harlem. We know in Ward's Island, right? So we do know that that in terms of the overdose deaths in East Harlem, that they are not the majority from Ward's Island. This I know, but we can get back to you with more specific data.
But
Eva, go ahead. It was Eva's question. Eva, go ahead.
And what I was trying to say is it's a decade, many decades of the government placing social services in Harlem. So you have homeless shelter residents, you have supportive housing being placed in Harlem, and the supportive housing are supporting people who, some of them have addiction issues, right? So it's not just, even if you just take the current cut of data that may indicate that Harlem has more overdose than others. This number is just after decades and decades of accumulating people. And
Eva, I'll fight with you. I'll disagree with you on the permanent housing, but you and I will agree on the transitional. But the permanent housing, I don't want it to go anywhere. Just FYI.
Madam President.
Yes, Madam President. Go right ahead, Madam President. Dr. Booth.
I agree more with Eva, what she's saying, and thank Barbara Nelson from CB10, who had served on the health committee with me. Absolutely. Because the borough president and I guess 2 years ago, because we were in COVID, when we had a big meeting at the Apollo Theater. And we're going through the same thing now with Mount Sinai. Harlem has been, whether it's true, whether they live in Harlem, whether it's the zip code, our community just has had enough that they do not want to hear anything about any substance abuse, anything coming into our communities. Unfortunate. For yes, we do need some things, but we have a lot of them. And as Barbara said, our neighbors are crying out. They can't even go into banks. It's just outrageous. And so all the things you say is good. And maybe a ban, as my colleague Nelson put out there, but our borough president have worked with us. I've served, this is my 6th year serving as health chair for CB10. And they just don't want to hear it. They don't want to hear anything anymore because they don't believe it's all our community. They think that you're bringing people in from other communities. And we did have some data. Anna presented us, say that to us, that all the drug centers, it wasn't our community. It was people coming in even from Westchester, Yonkers, into our community. So it's just been, as Eva said, decades of this community being overburdened with these centers, and we still have people laying out on our streets, into our doorways and hallways, and neighbors and people just don't want it anymore.
Okay.
And we all want people to be healthy and to be able to live free from drugs, but it just haven't shown us with the ones that we have being oversaturated.
Okay, thank you, Hazel. John Gallagher, and then Keisha. John, go ahead.
Yeah, I mean, I do have to support some of the views by like Eva Chan and Hazel Dukes. When I was a young person, we had a huge heroin problem in Inwood and Kingsbridge in Upper Manhattan, Kingsbridge in the Bronx. That was mostly ethnic white males. It was a pretty significant problem, but all the treatment centers were in Harlem. You know, it was like basically Inwood and Kingsbridge exported their heroin problem to neighborhoods like Harlem. So there's a certain reality to that. But I think that basically also points out the problem that if you were in a neighborhood like Kingsbridge or Inwood in the Bronx back in the day, like in the 1970s, you didn't want those people there. So you did a NIMBY thing to make sure they went to a neighborhood that couldn't fight for itself. So I think if you look at the current heroin problem, it's not just in one neighborhood, it's in a lot of neighborhoods, and no neighborhood. I'm not saying that I want to support Ms. Dukes here and Ms. Chan here. I mean, it's like, you shouldn't have to disproportionately take the effort, but most neighborhoods seem to not understand that these are their children. You know, that it's their children who are getting sick, and that you should support them in the community where they live. But I think one thing I have to ask for the commissioner is, I think we're treating heroin as though it's a problem that's not about a larger systemic personal crisis. There's other comorbidities involved in terms of illnesses. There's mental health issues. There's chronic pain issues. And I'm wondering, I mean, is there any attempt now to simply get beyond giving methadone out and try to deal with the comorbidities?
So I mean, I would agree with you that certainly there's a lot of comorbidities. I mean, you know, and we certainly also have been working on our mental health, you know, treatment programs. We also know that during COVID that, you know, more and more people experience mental health symptoms. You know, I think right now it's, we want to make sure that we keep people alive so that then we can deal with all of the comorbidities. And so, again, given that that this will be the deadliest year on record, we need to keep people alive, you know,
Yeah.
and then, you know, helping them link to all of the services that they need, including not just drug treatment, but like you're saying, social services, mental health services, primary care services. And so, you know, we have supported, for example, our Syringe services programs to really provide some of those other kinds of services to really address the comorbidities.
All right, we're going to go next to Keisha Jackson, then Shula Warren, and then Oscar. Go ahead, Keisha.
Hi, good afternoon. I'm a parent of a child who attends HVA elementary school, and I have a big concern taking my daughter to school and picking her up. I contacted the 28th precinct. I started a petition because it's unfair that these children, morning and afternoon, have to see needles on the floor, so many drug programs in the facility of the school, people selling drugs, shooting up drugs, nodding, sometimes indecent exposure. And my thing is, if this was District 2 or District 3, where it's not a lot of minority children, would this be going on with so many drug programs with these children's school? It's unfair to these children. Even when they have recess in Morris Park, it's dangerous for these children. So my concern is, yes, these people need help, but what about the children? They should not see drug selling. They should not see indecent exposure. Needles on the floor. What if someone is HIV positive and the kids get stuck with the needles? I've been complaining for 2 years and nothing hasn't really changed as of yet.
Okay. Keisha, thank you very much. I appreciate it. Warren Puder and then Oscar.
I just want to also just make a comment.
Oh, go ahead. Yes.
You know, just in terms of the overdose prevention centers, what we do know from research is that they actually reduce the syringe litter in the community surrounding them, and they also reduce public drug use. And so just to put that out there, that is known based on the research from.
Not around my daughter's school. I'm sorry. We step over needles. We step over
No,
drugs.
Keisha, hold on. What she's saying is that in the future, if we have these centers, I'm not saying it's right. I'm just saying what she's saying. The centers don't exist now. There are no centers here. Just so you know, she's saying in the future.
Yeah.
So by the future, could it please not be placed by schools where children have to go to school at? It could be anywhere, but not around schools.
Right.
When you bring programs like that, also bring problems. Like where HVA is at, these people's picking up methadone, and you see the drug dealers selling the drugs.
Yeah, well, near her school is true. I know that school well. Okay, I think what we need to do is rent a plane and go to Vancouver. I'm not kidding, and see. So people need to see and believe. You got to actually see it to believe it. So
yeah, we need statistics.
Yeah, and real life, real examples. Shula Puder.
Thank you, Dr. Cunningham. Earlier this year, in an article in the City, they posted a draft of an authorization letter, I think between at least then Dr. Zucker and also Housing Works, and it cited 5 sites statewide with one in Ithaca, the rest in New York City. Could you just talk for a moment about if that's changed, the number that you're expecting would be open in New York City?
So I would start off by saying that there's a bill right now in the state that will be brought, I think in January, that specifically is to have a pilot project for overdose prevention centers that are 5 sites, as you mentioned, 1 in Ithaca and 4 in New York City. So that is a bill that will be discussed in January. In terms of for us going forward, I mean, we are still exploring. So in terms of the where and how many, we're still in discussion. So I don't have a specific answer for you, but at the state level, there are bills in place that will be discussed in January.
All right, Shula, anything else? No. All right, Oscar, go ahead. Thank you for joining us.
Hi there, Commissioner. Thank you so much for your time. I wanted to ask if the Department of Health has given any consideration to partnering with other city departments, or has done any research or plans to do any research into using existing infrastructure as opposed to opening new centers. Is there the possibility to use existing infrastructure for these centers, or is that something that the Department of Health isn't considering?
Yeah, so this is exactly what we're considering, is using our existing contracted partners. So for example, the Syringe services programs, they provide services to people who use drugs. They provide medication treatment, they provide clean needles, syringes, they provide HIV testing, hepatitis C testing, link people to a host of services. And so the idea would be to sort of expand those services, right, by adding an overdose prevention center within the context of sort of the larger number of services that are provided. So again, these are the things that we're exploring right now. But I agree with you in general that using the sort of existing partnerships is something that we are definitely considering.
Thank you.
All right, I think that's Dr. Cunningham. Thank you. I want to say, from somebody who's been through this for quite some years and who we've been working with the groups in Harlem, with the groups in Washington Square Park, with the groups of Sarah D. Roosevelt and the Midtown. I think I've been everywhere. We've tried everything in terms of, I think, in Washington Square Park, we have about 5 or 6 drug treatment programs working with the Parks Department and the Police Department. In that case, it is having some impact, 6 a.m. to 8 p.m., 7 days a week. So you need that kind of support to do what you want, which is to keep people healthy. I mean, it's over 2,300 now deaths. So got to keep people healthy. I know people who've died, and I assume there are people on this call who know people who died. We do not want that to happen. But at the same time, right now it's not working. Whatever we're doing on the streets, with all due respect, particularly in what I call the 125th Street corridor and Midtown, it's not working. So, you got to put as much effort into that. And when I say you, I mean the administration, as you're putting into opening the centers. So I don't know how to do it, but that's what has to happen. And somehow that is not what people hear. So I'm just hope you hear what we're saying, and that somehow the two can come together, because I don't know if that's what's happening in Vancouver. They may have a different situation. My understanding from cops, which is even more frightening, is that the people who are coming to sell to 125th Street, which is also your problem, are not from the city. In fact, they have no prior arrests. They're just looking at the money, and there's so much money to be made, they're doing it there. So you got a lot to deal with in terms of interagency coordination. I assume you know that, and then at some point, if you could get back to us with some of we'll send you a note with some of the questions, like the nuances, housing statistics and things like that. That would be very helpful.
Okay, thank you very much for this opportunity to come and speak to you all.
Thank you very much. We appreciate it. So I think Pillars is next, Jessica.
Yes.
So this is our hero, just so you know. We like you, Dr. Cunningham, but Felicia Pullen, oh my gosh. So we just love her. I call it the Pillars. I don't know what she's got different names. All I know is I went to the opening of her space, and Oasis Commissioner was there, and people from the community, Athena Moore, me, and others. And ever since, whether it's going door to door at Grant, Manhattanville, or I don't know, any other development, or just trying to figure out how you can help people where they're at in terms of their drug treatment, their mental health, what kind of resources they need. She's there. So Felicia, the floor is yours. And as you know, you have a lot of fans here. So go ahead.
Thank you, Gail. And it's an honor to be here, and coming on the heels of Chinazo. I hope that I can live up and answer a lot of the questions that you may have, but thanks for the intro, and I'm glad that I was invited here. And so the first thing I want to say is that I am a baby of Harlem. I was born and raised in Harlem, and I came back to Harlem to give back to Harlem. And so I'm not a voice at this table of someone who is outside of the community. For those who may not know, what we do here at the Pillars is holistic approaches to substance misuse recovery. We are not a treatment center. We do not do counseling. We do not do residential or outpatient work at this time. What we do is support people who are self-identified as being in recovery, people like myself. And so I'm not going to take a lot of time talking about the Pillars. You can certainly look at our website at pillarsnyc.org, and I'll see if I can drop that in the chat. But I did want to just talk a little bit about some of the things that we are experiencing here in Harlem, and then some of the things that we are doing to try and support some of the concern that I've heard so far, and also some of the compassion that I've heard from others on this call. And so our friends at Counter Drug Task Force, Army National Guard Counter Drug Task Force pulled some data for us that I wanted to present. And this is preliminary data. This is not coming out of DOHMH, and this is not coming out of the medical examiner's office. But to date, we are looking at 136 suspected overdoses in Harlem between January and September. And so the zip codes with the highest rates, let me just take a half a step back. Of those 136, 43 were fatal. And so I'm not here to advocate for a safe overdose site or not. But what I am saying is that there is a need in this community to address some of what we are seeing relative to overdoses and overdose deaths. So of those 136 in Harlem, 43 were fatal and 97 were reversed with naloxone. The zip codes with the highest rates were 10027, and a lot of what we are hearing today, we understand why. I heard the mom who has children at HVA. I am very connected to HVA. They were one of the first schools that we worked with on the Safe in Harlem side. And so it is very difficult for children to walk down 124th Street between Lenox and 5th and walk through what we know are people who are trying to get treatment, right, from the methadone clinics that are there. And then some who are there for other reasons, right? Whether they are there to use and or to purchase. And then the other zip code with the highest rates is 10029 with 20 ODs. 16 of them were suspected to be fatal, followed by 10030 with 14, with 11 of them being fatal. So, you know, I heard a lot of, so what can we do? One of the things that I think is important for us to understand and to consider is an expanded definition of what harm reduction is. Harm reduction includes the concept of a safe OD prevention site. Harm reduction includes places like the pillars to help prevent relapses, to help prevent adverse child experiences with the delivery of parenting skills enhancement classes, holistic approaches like yoga, meditation, acupuncture, right? Harm reduction not only includes the reduction of deaths, but the reduction of relapses. And I think that that's something that we really need to consider as we are looking at this opioid crisis in our community. I heard about systemic approaches and systemic issues contributing to, and we need to look at the rates of hunger in this community, the rates of unemployment, underinsured, uninsured, and understand that if we're talking about a multi-pronged approach, we need to look at the system as a whole and not just as the malady of use or misuse in this community. So I don't want to take up a lot of time speaking about the issue. I would really like to address some of the concerns that others are having to see if we can come to a place where, you know, we can meet and see some real change.
Alicia, thank you. I don't know, there may be questions later on, but I, you know, like I said, you do God's work and more. So, and you see that in the chat. Yes, Miss Pruitt. Thank you, Felicia. The next speaker is Alicia Aguilara, who's co-executive director of a wonderful organization called Vocal New York. And I really appreciate you being here, Alicia. Not only are you familiar on this issue, but the fact that so many of your members work on affordable housing, public safety, and many other things, and they're always respected when they're at a rally or speaking. So the floor is yours, and thank you very much for being here.
Thank you for inviting me. Yeah, so my name is Alicia Aguilara. I'm the co-executive director of an organization called Vocal New York, and we have been around for 22 years. We organize people who are impacted by HIV, drug use, mass incarceration, and homelessness. And probably about 80% of our staff is all about organizing and advocacy and passing law. So, you know, we recently passed, alongside Drug Policy Alliance and other allies, the Marijuana Regulation and Taxation Act. So, you know, legalizing marijuana in a way that's really rooted in racial justice, and where the tax revenue is going to go to some of the programs that to curbing drug prevention programs, drug treatment support, and also to like public schools and to Black and Brown communities that hit hardest by the drug war. And lots of other things. We passed the law to basically make naloxone anybody could have naloxone in 2014, which hopefully many of you know what that is. And we were able to get into the hands of lots of community members, first responders, and lots of other legislative victories over the last 20 years. And we also operate a syringe exchange program. So don't kill me, but we're in Brooklyn. And we've been—
I'll kill you.
I know, I was like, oh no, I don't want to tell this group that. But we're in Brooklyn, but we operate in a very similar way and orientation to the other harm reduction organizations that are in where you guys are at. So there's a Housing Works one in Midtown, New York Harm Reduction Educators in East Harlem, and then Washington Heights Corner Project in Washington Heights. And so those are some of our, and then there's also one, the Lower East Side Harm Reduction Center. So we all kind of like do the same thing in different ways. And so, or in similar ways. And yeah, I mean, you guys are talking about everything, right? Like you guys know the issue. I don't need to tell you what these centers are and like what the challenges there are, but I just wanted to talk a little bit about like from the insider perspective of like, you know, I hear a lot of, and this happens where we are in Brooklyn. It's like, oh, okay, if we get these centers open, then there won't be any drug use on the street. All the syringes will be gone. And like, we're really going to fix everything. And, you know, I want to just talk about how like challenging it is for us even to, you know, we have people that go around every morning, every middle of the day, afternoon to pick up syringes because, you know, I have a little boy who plays in the playgrounds by our office and I don't want him with playing with syringes either, right? Like those are, and really the people who come to our center to get that need services, like they have families too. They live in the community too. And we all try to like reorient around like health, safety, and keeping people alive. And so, but it's not, you know, it's not anything that one nonprofit or one organization is going to fix. And, you know, I think the way that I've been thinking about it is how much like the connection of coming to our sites can really improve people's life. I'm thinking a lot about during this conversation about two of our participants. Their names are Victor and Drifter. Drifter is a veteran, and she's been living on the streets for probably over 10 years at this point, and alongside her, Victor. And those two are getting arrested all the time, right? So they have like a push cart. They're chaotic drug users, you know, they're people that you see on the street, they look like they use drugs, and all the brownstone Brooklyn people, all the homeowners, they have my cell and they go, they're on my stoop again, they're on my stoop again. And, you know, I go and I find them and I'm like, hey, come on, like come inside. And it's been a real struggle. And thankfully, you know, or actually a few years ago, you know, Victor, they and Drifter were sleeping outside one of the coldest days of the year. And then Drifter, I really wanted her to come inside, but she didn't want to. And she ended up getting frostbite and losing her leg. And so now you have the life now having a wheelchair. And so that making everything more complicated. And, you know, during COVID, we were really worried about them. And because Drifter's a veteran, she has access to like the VA, and we were just like working, our care coordination team working to get them housed. And we finally like found somebody that would house them. And that was like a 10-year process, which is kind of crazy. And it took so much trust, and they have so much trauma and distrust. And I say all this just to say that like, there's not going to be like one service that is going to change people's lives, right? It's about building relationships. It's about telling people that like, we actually, hey, we're wondering where you were. We didn't see you. So much of it is like, hey, I haven't seen you in a couple of days. Are you okay? And so many people will tell us like, I didn't know anybody even cared where I was. And those are sort of those first steps that like are really rooted. That's like what harm reduction means to me, right? Meeting people where they're at, bringing them in and talking to them. Because a lot of our folks, the number one thing that's like challenging their lives, they're not going to say their drug use. They often say like, it's because I'm homeless. It's because like, I've had so much trauma with my mother, or I lost the love of my life, or I'm like all these other things that make whole people whole. And oftentimes the drug use is just like a manifestation of other pain and suffering. And we see this so related with COVID, right? So the social isolation, the economic distress. And so, you know, I know you got, I do appreciate like this conversation. I know it's really difficult and challenging, and I appreciate a lot of the nuance and the care that a lot of people are leading with, when at the same time you're saying like, yeah, and I don't want syringes on the street when I'm walking to my kid to school. Like, that's so valid. And so the one thing I want to uplift is that like the overdose prevention centers that are being proposed right now, they would all be rooted in harm reduction organizations, sort of like mine that's in Brooklyn, but one's in Manhattan in the city. And, you know, I think those are very, very different from methadone programs, right? A lot of methadone programs, our people view them as very like punitive. You have to go every day. You get in trouble if anything. And we're working from a very different framework. And so I hope that people will sort of be open to the idea, open to the orientation. I think the idea to the earlier question right now, from what my understanding is, like, there wouldn't necessarily be a new footprint. It would be like, you know, going deep on these organizations that already exist. And you know, I hopefully that they will be sort of like that first step that many people need to get to a place of being healthier and safe. Because I think we all can agree that, you know, sleeping on the street, injecting in the street, that's not a dignified life that anybody wants to live. And there's ways to get people like to a better place that don't involve police, that don't involve like forcing them into treatment. And we think harm reduction is that path. So I'll just say that, and thank you guys for giving me a little bit of space, and looking forward to talking.
Thank you so much. I know Henrietta Lyle had a question, and I'm sorry, I didn't see the hand earlier. Henrietta, do you want to ask? I don't know if you're still here. Oh, there you are. Yeah, go ahead, Henrietta.
You know, I must say, you know, I believe Sean did the study. He sent out some charts recently, random versus non-random, showed the proliferation of—
Henrietta, talk up a little bit. Go ahead.
It showed the proliferation of the centers in the Harlem community, and just the fact that we are so overwhelmed with this. But I definitely appreciate everything I've heard, because it's given me a new insight into the needs, just like Barbara said. But when I was chair of Community Board 10, we did visit one of the sites on 124th Street, and they shared their concerns in terms of their customers going outside and hanging around. One of the things we talked about so much was that school down the street, that they were having so many problems because of this one center. And we were trying so hard to work with the center. And then what happens a couple of years later, here comes Mount Sinai. No one seems to be paying us any attention in this community. And I must say, I do appreciate everything everyone's doing, especially Greater Harlem, you know, community, in terms of what they're doing to bring this to real light with some statistics. And while we want to help and be there for everyone in our community, we just need to do something with the overproliferation in this particular community, and what everyone sees, that what the children are walking into, what adults are walking into. We can't sit at bus stops because people are there all day. But I do understand what everyone is saying, and I do so, Felicia, what you said, and Alisa, I so appreciate learning more about what you are dealing with. So it's just something we've got to come together to make this work for everyone.
Henrietta, thank you. Henrietta's been a leader for a long time, and you know, it's a hard. Anyway, other questions, because I don't want to be the only one asking questions, or even asking of each other. It's fine. John, your comments are great in the chat too. The chat questions are excellent. It's just this is about the hardest issue in the world to get addressed, for lack of a better word, where you want people's lives to exist and be fruitful, and at the same time have children able to walk to school in a peaceful setting. So it's hard, and it has to be fair to every community. That's the other problem.
Thank you.
Felicia.
Borough President, may I just—
Yes, Felicia, go ahead. Yeah, please.
And thank you so much, Jessica. In the beginning of this meeting, there was mention of, you know, approximately $208 million was the last number that I heard that is coming down the pike from the opioid settlement. And I think that it is crucial for us as a community to advocate for our fair share and to understand that we're not just talking about treatment when we're talking about the allocation of those funds. You know, Safe in Harlem, which works with teens and youth and creating teen leaders to address this issue among their peers, lost $125,000 after 5 years of funding. And so working with kids in HVA as our, you know, our boots to the ground leaders, we no longer have that funding to do that work, and all work stopped. We have to understand that that money should not only be allocated to treatment and to the traditional form of harm reduction, but training residents to become first responders in public overdoses is a way to address some of what we're seeing on the streets. But when we are not standing up for ourselves, going to our senators, going to our congressmen, and allocating for our fair share of prevention and recovery dollars in addition to the treatment, then we're selling ourselves short in Harlem.
Right. I mean, we had a press conference, Alicia, just so you know, you probably do, on that topic. We want money for Harlem, Midtown, and some other places in the borough of Manhattan. We had a very huge turnout, and we're 100% with you on that topic. My understanding is, even though I would love it to be available right now, my understanding is it's not till January. By the time they appoint, I don't know if it's the mayor gets up to 246 million. And I don't know if he appoints a board in January, whomever the mayor may be, or if it's the attorney general, but there has to be a board. So somehow a city like New York comes up with a list of programs and projects to support. And then I don't know if the mayor makes a decision or this board makes this, it's not really clear. So that's where we're at. So we're very, very focused on that money. I am always following the money. So I agree with you. And thank you for bringing that up. Because when we had a press conference, that people realize this is serious and pay attention. And we also thank the AG for doing that. That's thanks to her. Other questions? Jessica, do you have any questions? No.
I don't see any hands.
Okay.
No.
I don't see any other questions. All right. Alyssa, is there anything else that you want to add about, do you have any experience with some of the centers elsewhere? I don't know, like in Vancouver?
Well, the thing I'd say, I mean, there's a lot. It's funny. I was actually the person who ran the Vancouver site actually lives in New York City, and she was speaking to our staff this morning. So it's funny that you mentioned that. But the thing about Insight is that they're huge. It's like a huge, and they're open, which, you know, is 18 hours a day, 7 days a week, 365 days a year. And she was telling me that, like, on a busy day, they have like 1,000 people go through there. So I'm not sure that's exactly what you guys are wanting. But it is, you know, I think in terms of, you know, it's like there are lots of models around. And there's also ones where in, like, I think the difference of like Vancouver and Toronto and places is in some ways, you know, 125th corridor is that for New York City. It's like, you know, the drug scene is very decentralized across New York City, right? We don't have sort of like the Skid Row or sort of these like parts of the city where there's like lots happening. Probably 125th Alexis, maybe that, but it's not to the same scale. So I think in other places they locate them in those areas because of that. And so I think if you're thinking about the city, you know, it's a bit dispersed. So I'm not sure how it happened, but I know the folks in Vancouver and Toronto and some people just do it in the park, right? And set up a mobile site, and that's been happening as well. I think COVID and everything has just spawned a lot of like people, like, you know, in some ways, in like how my organization was founded 25 years ago because of the AIDS epidemic. And I think you're seeing a lot of innovation happening now where the overdose crisis is people are figuring out how to keep each other alive.
Okay, Carl, Dawson, you had a question? Go ahead. Carl, I know you're here. Dawson? Okay. I hate Zoom because we can't be together. All right, is there anything else? Because I can't find Carl. I know she did. Sylvie Cohen, go ahead quickly. Sylvie Cohen, you had your hand up? No.
Yes, good afternoon. Yes, very important debate. I want to know if we could get an update on how the State Advisory Board for allocating the settlement funds is coming up, and how can Harlem have a strong voice in the decisions about funding that includes a holistic approach, including, as Ms. Poulen and others said, prevention and recovery, but through welfare.
That's a good question. I know we will find out about the board because I don't know, but I'm sure we can find out. But I do think, I know Felicia and I have had many opportunities to try to work together on getting funding. We know how to do that. But I do think that Harlem in general, whether it's through the community boards or the CECs or other opportunities for working together, needs to do exactly that. So whether it's East, Central, West, we will figure that out. But that's a great point. And thank you very much.
Yeah, okay.
Go ahead.
Okay.
Go ahead.
No, I said, well, it's good to say the community, there's a dialogue with the community, but what does that mean really? Is it community with community boards, talk to your elected officials? What's the process really? Can we have it mashed up and, explain and broken down, please, sometimes?
No, I can just say when you're applying for funding, because we've done it with REDC, which is the state money. We're doing this right now in Chinatown as well. Wellington Chan knows you have to put together all the different stakeholders. Then the funding entity sees that you're working together. And to me, the only way that you should get funding is if the community is working together. So breaking down, I can't be specific, but I can tell you it would take the vocals and the pillars and the community boards and others.
Is there a guide about what's being funded or not? I mean,
not yet. There's no guide yet for this particular amount of money, no.
Thank you.
Yep, thank you. All right, I think Carl didn't come back. Carl Dawson. All right.
I did. I just came back.
Oh, you did. Go ahead.
I just had a very quick one. I was thinking as all these discussions about additional services for the opioid crisis, sort of, how to maybe introduce them in a way that could be more broadly embraced in the community. And I think part of the discussion needs to be sort of what additional services are also being provided to make sure that there is safety. So, I was just, on the train in the middle of the day the other day, and there were 2 police officers in my car accompanying somebody that was very high. And he wasn't attacking anyone, but he clearly was having sort of a dialogue with the officers, but they clearly were accompanying him back and forth. And yes, did I change cars after the next stop? Absolutely, because he was completely out of his mind. But there's also not a great allocation of resources to have 2 officers have to accompany this guy all over town because he's completely out of his mind. And so I think having, certainly people want to have everyone regain dignity in life and have a future. They also want to be assured that their personal safety is not at risk because of the completely unpredictable behavior of someone under the influence. And so somehow having those discussions of if we're going to have additional strategies rolled out in the boroughs, what is also the additional strategy that is providing care for the entire community so that we don't have to, have that concern that we're only accelerating the risks that is random and unjustified to all those that are actually, it's like a balanced discussion. And I think that's a really important element that we can't just have one side, and you can't have both sides come together unless you have both of those addressed.
Right.
So that's all I wanted to say.
No, thank you. I tried to say that at the very beginning because I've been through this discussion already with the center, so I know what's happening, but I also say at the same time, if you're going to have the centers, what are you doing to support those in the community who see some of the challenges on the street? So how do you pair them so that it's a win-win for everybody? And I don't think we have an answer to that yet. So that's
I'm sorry, I joined late, so I'm sure I should have known you would have said that. But
no, thank you very much. John, you want to close us out and then we're going to get done. John, go ahead, Gallagher.
Yeah, I think I have a real problem. I mean, Carl, I'm trying to be open about this. I've known most of the people I've met who were addicted to heroin are not the people who are necessarily destructive on the street or dangerous. And most of the people I met on the street who are destructive are not dangerous. I mean, you know, there are people who either have, I mean, like a lot of the people, there are a lot of people who actually are able to sustain themselves and maintain some quality of life while being addicted. And there are a lot of people who are, you know, have a broad spectrum of problems. But I think you pretty much put one of the context there. You immediately jump to some conclusions about this person, which I think is fair. I think I would do the same thing on the subway myself. But who's left stuck dealing with it is two police officers with no formal training in either medicine or addiction or mental health or any of this stuff. And one thing I'm very hopeful about is, cross your fingers, it's probably going to happen. We're finally going to have a district attorney who grew up in Harlem, who actually has a lot of familiarity with the community and who probably won't be tempted to deal with everything as a crime problem. But I mean, but to get back to what Jennifer said, yeah, they might be using drugs, but they're using drugs because they have untreated PTSD, or they're using drugs because it's one of the few ways you can get through living on the streets is to get some relief, is maybe some drugs. I think most of the people I deal with on the street who I talk to, and I'm not a person, once you break through the initial discomfort, they're people. And they have real problems that are not necessarily related to the drugs. The drugs are a symptom of the problem they have. And I'm a little uncomfortable because I think we're not really, like, I think one of the reasons why it's better in Canada is because you have a cradle to grave medical coverage. You know, if you have a problem with that can lead to addiction, it will get dealt with, which we don't do here. I mean, you know, we're coming up with all these things, but if you don't have healthcare to begin with, and and you're in chronic pain, and someone says this will take care of your chronic pain, maybe you just do it.
Okay.
So
Thank
I
you.
mean, so I'm sorry to jump out like that at you.
No, that's fine, John. I appreciate it because you have great experience. So John is also a member of the CEC in 6, just so you know, with kids in the school. All right, thank you, everybody. So we're going to see you next week, 3 o'clock.
Next week's a holiday, so we're going to skip one Tuesday.
Oh, I didn't know. I don't know nothing about holidays. I'm not too good on the holidays.
Yeah,
All
next
right.
Tuesday is
I
election
don't
day,
even know
but
what
we'll
the
be
damn
back.
holiday is. Okay, so the following Tuesday, right?
Right. Yes.
Well,
Okay.
good luck, Ayla. Good luck, Ayla.
I'm running for office since I don't even know it's a holiday. That's how bad I am.
We need you in the office.
Thank you, but I don't even know when I'm running for office. That's how bad it is. Okay, thank you. Thank you, everybody, and I'll see you a week, 2 weeks from now on a Tuesday. Thank you very much. Thank you all.
Tommaso Cunningham for OASIS Commissioner.
Yes, thank you very much, Dr. Cunningham. Thank you.
Thank you.